Human immunodeficiency virus is a virus that primarily targets CD4 cells, a type of white blood cell that plays a key role in the immune system by helping fight infections. As HIV replicates in the body, it destroys these cells. The amount of HIV in the blood is called the viral load, while the number of CD4 cells is measured as the CD4 count. Both of these are crucial in understanding the progression of the disease. When someone is diagnosed with HIV, it means the virus has been detected in their body, regardless of how advanced it is. AIDS, acquired immunodeficiency syndrome, is the late stage of HIV infection. It is diagnosed when 1. CD4 cell count. If the CD4 count falls below 200 cells per member, the immune system is no longer strong enough to fight off certain infections and diseases. 2. Opportunistic infections. Even if the CD4 count is above 200, an opportunistic infection is an illness caused by pathogens like bacteria, viruses, fungi, or parasites that take advantage of a weakened immune system. In healthy individuals with strong immune systems, these organisms are usually kept under control or do not cause disease. However, in people with weakened immunity, such as those living with advanced HIV or AIDS, these pathogens can cause serious illnesses. Why is monitoring both the viral load and CD4 count critical for people living with HIV? The human body can't get rid of HIV, and no effective HIV cure exists. So once you have HIV, you have it for life. However, antiretroviral therapy, or ART, is available. If taken as prescribed, it can suppress the viral load to undetectable levels, below 20 to 50 copies millius, help the CD4 count recover and remain at a healthy level. When HIV is effectively managed with treatment, the progression to AIDS can be completely avoided. HIV is transmitted through the exchange of certain body fluids from an infected person. This includes blood, semen, vaginal fluids, breast milk. It's important to note that HIV cannot be spread through casual contact like hugging, insect bites, shaking hands, or sharing food and drinks. Activities like kissing are also safe unless there are open sores or bleeding gums involved. Symptoms of HIV can vary by stage. In the early stages, some people experience flu-like symptoms such as fever, sore throat, fatigue, swollen lymph nodes, rashes. However, some may not show symptoms for years, which is why regular testing is so important. The good news is that HIV is preventable. Here's how. 1. Use condoms consistently and correctly. 2. Get regularly tested and encourage your partners to do the same. 3. Consider pre-exposure prophylaxis, PrEP, a daily pill for people at high risk of HIV. 4. Never share needles or syringes. 5. Pregnant women living with HIV should take antiretroviral therapy to prevent passing the virus to their baby. The only way to know if you have HIV is through testing. The high-risk groups include individuals who engage in unprotected sex, having vaginal, anal, or oral sex without using condoms or other barrier methods, having multiple sexual partners. The more partners you have, the higher the risk of exposure to HIV. Men who have sex with men, MSM have a higher prevalence of HIV compared to the general population. Sex with an HIV-positive partner, especially if the HIV-positive partner has a detectable viral load and is not on treatment. Sharing needles, syringes, or other drug equipment. People who inject drugs, PWID, are at high risk due to contaminated needles. Commercial sex workers and their clients are at increased risk due to multiple partners and inconsistent condom use. Having a sexually transmitted infection, STI. STIs like syphilis, gonorrhea, or chlamydia increase the risk of acquiring or transmitting HIV. Living with HIV today is vastly different from decades ago. People with HIV who take HIV medicine as prescribed and get and keep an undetectable viral load can live long and healthy lives and will not transmit HIV to their HIV-negative partners through sex. Stigma and discrimination still exist, but education and awareness can help break these barriers.